Good afternoon. I'd like to call the Hillsborough County Emergency Policy Group meeting to order. I hope everyone had a great weekend. Will the clerk please call the roll?
Miller,
Here.
Overman,
Here.
Merman,
Here.
Cronister,
Here.
Castor,
Here.
Ross,
Here.
Watt,
Here.
Snipely,
Here.
Ms. Wise,
Here.
you have quorum.
Thank you. We're now moving to the public comment section of our agenda. The Emergency Policy Group, the EPG, welcomes comments from citizens about any issue or concern. Your opinions are valued in terms of providing input to the EPG members. However, it is requested at the same time you address the EPG that comments are not directed personally against an EPG member, a staff member, or a presenter, but rather directed at the issues. This provides a mutual respect between the EPG members and the public. 20 minutes has been set aside for the public comment. Each speaker will have 2 minutes. Our first speaker is Jeffrey Puglisi. Mr. Puglisi? Is he there? Mr. Brewer?
Sorry, sir. He's having technical issues. Can you move on to the next
Okay,
speaker?
I'll come back to him. Thank you. Jason Kimball? Jason Kimball?
Control group, and it looks at the rate of infection. So cloth masks resulted in significantly higher rates of infection. That's what it says verbatim in this study. So I don't know what there is to discuss, honestly, when it comes to whether or not to renew this executive order. The executive order should not be renewed. You guys have been mandating something that increases the risk of infection, and you've been mandating something that's totally ineffective when it comes to surgical masks, totally ineffective at reducing the rate of infection. And it's been killing our economy, it's been hurting our businesses, and you guys still haven't stopped, despite the fact that this is the reason your group is dissolving. Your group is going to dissolve because of this order. It is madness to renew this order. We have businesses that are denying service to people with medical conditions despite the amendment to the order that you guys added. We have something with the recovery rate upwards of 99.75%. This is total madness if this executive order gets renewed. And I'm telling Commissioner Merman, if you vote to renew this order, you will not be reelected.
Sir,
no doubt
sir,
in my
please,
mind, I will make sure that I'm
please, sir, do not just attack a person. Just talk to your issues and do not attack any of the members, please. Go ahead.
Do what's right. It's very simple. Just do what's right. Represent the people of your county. Stop hurting the county. Just do what's right, please. Thank you.
Vanessa Anderson. Vanessa Anderson.
Vanessa, you're up. Vanessa, you are up. This is Glenn with HTV. Vanessa, you are live.
Thank you, commissioners. I agree with the last caller. This executive order needs to be repealed. It needs to be abolished. This mask mandate is completely ineffective in preventing the transfer of COVID. So what is the point? The only thing that's happening right now with this mandate is that it's preventing people from going to their local businesses without being harassed. Because although people supposedly have the right to be exempt from this mandate, whether they have a medical condition, but that's not what's happening here. That's not what's happening. People here are being harassed, are being discriminated against with medical conditions. And although it's written on paper that's not the case. That's not what's happening. And all that's happened with this mask mandate is that it is hurting businesses, it's hurting people. It's forcing business owners is to police their customers. This is unacceptable. Medical discrimination is what's happening. That's all that's been happening with this order. And I implore you, please do not renew this executive order. It is unacceptable. It's unconstitutional, and it's hurting people in this county. Please search your heart. You know that this is not right. Be on the right side of history.
Christine Quinn.
Or lies.
As a businesswoman and mother, I understand the concerns set forth here today. However, the supposed remedy is worse than the cure, and our children are suffering. They must be able to return to school and play with their friends without wearing masks. As a candidate running for U.S. Congress in Hillsborough County, it is my responsibility to stand up and protect our citizens from government overreach. Mandating masks is government overreach. First of all, you must have a plan that is limited in scope and length. You cannot just have an open-ended mandate based on personal desires or fears. There is not one scientific study of the masses wearing masks and the long-term detriment that may cause after prolonged use. Secondly, masks do not work. I am a manufacturer of food products. I am well educated and trained on the requirements of employees wearing masks set forth by the OSHA Act of 1970. If an employer mandates masks or provides masks to their employees, the employer must have a comprehensive written plan, a physician's medical exam, and have proper fitting, and masks must be changed regularly. This includes a log sheet with the employee's name, date, and time of first putting the mask on. Then the employee must monitor the oxygen intake every 20 to 30 minutes. If it drops below 90, it's considered hypoxemia. And the employer must give the employee a 10 to 15-minute break to bring the oxygen levels back up to over 95 or better. If it drops below 80, it may compromise organ function and could cause serious medical issues. My question is, because I can go on and on, is it a lot more, there's a lot more to mandating masks than meets the eye. Does the county and the city have a comprehensive written plan for your employees? Are you prepared to monitor every employee? This includes the police and all the city personnel, including you, the county commissioners, and the mayor. This mandates further, it is going into our businesses that is forced to mandate masks on all their employees. This opens every business.
Thank you, Ms. Quinn. Your time is up.
Consequences of
Thank you, Ms. Quinn. Your time is up. Thank you very much. Erica Elwell.
TV, Erica has dropped from the call.
She's dropping the call. Okay. Emily Wiseman.
Lies.
Emily Wiseman. Ms. Wiseman, we can't understand what you're saying. Ma'am, we can't understand what you're saying. Ms. Wiseman, hold on and I'll come back to you, okay? Just hold on. I'll come back to you. We can work out the communications problem here. What about Jeffrey Puglisi?
You are live.
Excuse me, Mr. Puglisi, hold on. Staff, are we having some problems with the communications?
Yes, sir. Yes, sir. This is James Brewer. We are experiencing a technical audio issue with the public comment. Is there any chance that we could circle back to this after we correct it?
Ask Mr. Puglisi and ask Ms. Wiseman, would they stay on to after Mr. Dudley does his presentation? I'll come back to them. Hopefully we'll work it out by that time, okay?
Yes, sir. Understood.
Okay, thank you. Mr. Tim Dudley, Emergency Management Update.
Good afternoon.
Good afternoon, sir.
All right. Are we up? And can you see me?
Yes.
All right. So, last week, in spite of the storm headed this way to Florida, the team was able to complete 8,342 tests. The state, out of abundance of precaution and anticipating the storm possibly heading this way, looked to shut down testing by Thursday, but the storm track became to be better predicted, and we were able to open up testing on the West Coast and continue our testing here in Tampa. So we were able to pivot quickly. Total tests were 84,154 total to date. Last week we had 8,775 appointments scheduled. This week, after turning appointments back on late Thursday, we've been able to get 2,090 appointments on the books. We have plenty of appointments left for this week and into the coming week. So please don't hesitate to sign up for an appointment. We continue to support logistics. We have plenty of kits on hand to support our sites. We continue to push out PPE as required. We have 0 guests in quarantine site, and we have 8 guests in our isolation sites. Are there any questions?
Okay, Mr. Dudley, I see no questions. Thank you very much for your presentation.
Thank you, sir.
Let's revert back to Mr. Brewer for public comment. Mr. Brewer, have we straightened out our communications problem yet?
Yes, sir, we have.
Okay, is Mr. Jeff Puglisi available?
No, he dropped off the call, sir.
Okay, what about Ms. Emily Wiseman?
Ms. Wiseman is available.
Okay, Ms. Wiseman, you recognize, ma'am?
Hi, yes, I'm here. Thank you. And can you hear me?
Yes, ma'am.
Yes. Okay, thank you. Businesses are violating your order section 9C and 9L, denying me admittance without a mask, even though I can't wear one due to an underlying medical condition. One such business is Sprouts. I have a 3-minute video of the interaction and them denying me entrance. Store managers of both Tampa and Valrico locations told me it is corporate policy, no mask, no entrance, no exceptions. I spoke with a Sprouts employee, and he said that customers who have been denied entrance to the store have called the cops multiple times, and the cops are on the Sprouts side. The cops consistently rule that the store is private property and that the customers can't enter without a mask, even if they can't wear one due to a medical condition, and then they ask them to leave. Last week, I was told I couldn't enter a small pest control store. I'm becoming too afraid to enter other businesses as the interaction and stress of being confronted and denied entrance worsens my medical condition. I am demanding that you equally enforce your order, not just to protect those who want to wear a mask and who can wear a mask, but also for those who cannot wear one. I am asking for equal protection under the law because it's not just one business, but many businesses throughout Hillsborough County. The order clearly states nothing herein shall require the wearing of face coverings by the following persons. 9 Section C, persons for whom a face covering would cause impairment due to an existing health condition. No business operator or employee shall ask a person not wearing a face covering pursuant to this exemption to identify a specific health condition or supply documentation thereof, nor shall any business operator or employee deny such person admittance or service because he or she is not wearing a face covering. And 9 Section L, the requirement shall not be applied in a manner that would conflict with the Americans with Disabilities Act. The CDC cautions the following persons should not wear face coverings: children under age 2 and anyone who has trouble breathing. So again, I'm just demanding and asking for you to please enforce this order so that people who do have true underlying medical conditions can enter the stores without wearing a mask and aren't given additional stress to exacerbate the very medical condition for which they cannot wear.
Thank you, Ms. Wiseman. Your time is up. Thank you very much. Thank you. We'll now move into public health update. Dr. Holt.
Yes, this is Dr. Doug Holt, Florida Department of Health, Hillsborough County. Today, we will again be presenting the updated epidemiological and hospital data for Hillsborough County. As usual, I'll present an overview and some take-home messages. And then before Mr. Wagner reviews the raw data, I've added a couple of slides just in an effort to clarify several questions that were raised last Thursday's EPG. Mr. Wagner, let's begin with slide 2, please. So an additional 373 cases have been reported this morning. So we are now at 30,449 cases cumulatively reported. The total percent of the population that's now been tested positive is 2.1%. and 352 deaths have been reported. So that represents 0.024% of the total population has died from COVID. The number of recovered is now 12,713, a increase of approximately 2,700 from Thursday. Looking at our trajectories of our cases, testing, and positivity, the 14-day average of our cases is 458, which is a continued decrease over 14 days of 32%. Our 7 days, as the graph will show, is 434. That is a downward. That is a reduction, but it's slowing. So again, I would caution everybody: let's not relax. This is time we have to keep up the efforts. We're still at a very high level. The 210 per 100,000. That's over the last 7 days. I'll discuss a little later, but this puts us in about the state average and comparable to our other counties within the range. Our testing, the 14-day average, is 29,210, which has continued to increase. I noticed a bit of a stall in the last few days, but actually I don't think that's the result of us having availability of testing, but I think the results are again being delayed and coming back, particularly in the commercial LabCorp and Quest in particular. The positivity rate, much more pleased with. The 14-day average is now approximately 11%, and I calculated our 7-day of 9.8%, just below 10%. So transmission rate in Hillsborough County for COVID remains high, it's widespread, but we are seeing some gradual decreases in both our cases and our positivity rate. Next slide, please. Hospitalization overall show improving trends. 7-day average census is 422, a 21% reduction over the prior 7 days. Our bed availability remains high, 40% or so available per the Kappa General, little less under the ACA, but the trend is similar, a slight decrease. ICUs are a bit tighter and it's showing a little of increase, but again, well below levels of concerns. Our admissions per day of COVID have slowed notably. They're now at 42. Long-term care during this past 7 days have averaged about 9, so that's 20%. That's fairly stable. Our deaths reported, again, 352. As a lagging indicator, this is still showing an increase from the prior 7-day period. Let's see, Mr. Wagner, would you go to the next slide, please? Before we go into Mr. Wagner's, I wanted to again provide a little clarification of a couple of questions that were asked. The first had to do with why it shows the 7-day total new cases per 100,000 versus the daily average. I've taken this step down that we did, recolored it, and included to just sort of hopefully better explain that. The 7-day total cases is what you will find if you look on most of the major dashboards, the COVID tracking websites that are out there. What it allows us to do is to sort of see where we are and our trends in comparison to other counties in Florida or across the country. So, for example, we are currently at 211 per 100,000. That's 30 per day in a trend if you just divide it by 7. The state number is 295 per 100,000. This is distorted somewhat by Miami-Dade at 660 cases per 100,000 and Broward County at 442 cases per 100,000. So to looking at more of this way, I can look at sort of apples to apples. And if you look at this, you would be able to see that the risk of getting infected in Miami-Dade or Broward is 3 or 2 times what we're having here in Hillsborough County, respectively. But again, noticing the rest of the state, including Tampa Bay, we're all about 150 to 250 cases per 100,000. So that gives us a sense of where we are locally. The one-day average is used when the public health experts, specifically Harvard Global Health Institute, provided some guidelines that related to the level of community transmission. What are the appropriate or some recommended mitigation strategies that could be used? And they use this, I assume, mostly just because it's easier for the audiences to relate to as you look at their break points. So if we use that sample, their criteria was cases above 25 per day per 100,000. You were in what they call the red threshold. This is a higher level of activity. And then once you get below 25 cases per day, you enter what they have an orange category, and where you have a lower level but still very highly active, all the way down to the threshold of where you get below 10 cases per day. And once you get down to the 10 cases per day, you're in the yellow, as you'll see with our, down into the, below that is the where I have a step about halfway. But ultimately, our end goal is to get to green, which is where we're having 1 case per day per 100,000, which would translate into about 14 cases reported daily. Before we leave this slide, and when I look at the mitigation ask, I do want to now relate this to the question that came up about our contact tracing staffing. We sort of aimed for in relation to these numbers. Essentially what we're trying to do, or what we want when we're fully staffed, is we can effectively manage in the use of contact tracing as a containment tool, where we're actually contributing to the reduction in transmission and the breaking of the chain, if you will. We chose a staffing that would be around that midpoint of the orange, so it's at 15 per day or 210 cases per day. That basically, it's in the middle of the orange level, where our number of investigators working throughout a 7-day period can make contact, interview all of our cases, the goal of 80%, everyone contacted within 24 hours of us receiving. So when the cases get above that level, we'll still have that staffing, and they'll work to prioritize, but we realize our impact from a contact tracing and a containment aspect will be less, and we're more trying to mitigate or reduce the significance or the consequences. But of course, our ultimate goal is, as we move down the steps and our cases decrease, the staffing becomes much more optimized, and contact tracing becomes a full containment tool, and we can really accelerate, hopefully, the down slope of our return to the green category that we were aiming for. Throughout this, remember, every time I talk about contact tracing is dependent on our testing, getting our results promptly, and also some supportive isolation. Final reminder is that even as we progress down this slide, just more testing, more contact tracing won't replace all of our personal efforts, responsibilities. we need this to continue as we're going to achieve that green target. Next slide, please. Finally, this is the table that references, and I think blends kind of what we're trying to do and how we're going to get there. So this is the CDC, it's a merger of the CDC recommendation and the Harvard Global Health Institute. So the far column to the left is the CDC's description of the amount of community-based transmission that's occurring, and that they have the highest substantial uncontrolled transmission. That's currently the category we are in. They provided some community characteristics, which provide some distinctions, but what Harvard did was they gave a number, and that's that 25 cases per 100,000. So these relate to the categories that we want to, where we are now, but as we go downward, we want to see the impact of all our collective efforts, the community, the public, and the public health sponsors, so we can achieve these goals. Mr. I'll stop there and answer any questions before we move on, if that's appropriate.
Yes, sir, that's appropriate, Dr. Holt, but I see no questions at this time, so we can move on.
Mr. Wagner, please continue.
Thank you. Kevin Wagner, Business Analyst, Healthcare Services Department, Hillsborough County. Again, as we're outlining on the dashboard that we rolled out in the last month, the green components indicate a positive or flattening from the metrics identified by Dr. Holt. The red indicate or salmon color areas of concern or areas that need to be reviewed. With regard to the dashboard on the second row, we see the testing at 29,200 is a red or an area of concern, but please be mindful that the target recently changed to 47,000 with the need for continued testing, as discussed by Dr. Holt earlier. With regard to the last row, the hospital occupancy for total beds using the TGH data exchange has trended upward to 62%, but we give the slope of the last 2 weeks at least to see a downward or downward and an upward spike again. So that's an area of continued monitoring. And then on the ICU occupancy, 81% through the TGH data exchange, that has continually increased if you look at the individual days and even on the 7-day component. So again, those are the areas of concern from a hospitalization standpoint. With regard to the total cases, and again, we are working on Commissioner Overman's request to update this case by summary day. The bottom chart is the line bar chart. So historically, if we're looking from July 5th all the way to basically yesterday, August 2nd, we are seeing a downward and flattening trend, especially on the far right-hand side within the last 10 days, where the cases are generally within the 400 and 500 range, and some even down into the 300 range. So the trend is flattening, but not significantly decreasing, based upon the efforts by all members and citizens. Again, the 7-day average, as Dr. Holt indicated, is 434 cases per day. The 14-day average is 458. So that's showing that the 7-day, we're seeing lower cases come in by and large of that 7-day sample, and the trend has been decreasing. So that's positive. And Dr. Holt indicated today there was another 370. So again, in that 300 to 400, maybe low 500 range is where the community is currently versus where we were. With regard to testing, total population, when total tests, including the antibody tests, around 19% of the population's been tested for Hillsborough County on using the 1.4 million population rate. So again, testing has increased and ramped up. With regard to the overall testing on the bottom row, we are seeing higher numbers as we've talked about, the total number of tests and the positives received. the 7-day and 14-day average of positivities has trended downward. Again, the 14-day, as discussed, is 10.96. The 7-day was 10.3, and Dr. Holt indicated when we add today's number, it's near or below 10%. So again, the positivity rate has come down, over these last 2 to 3, 4 weeks, respectively. The hospitalizations, when we look at each individual day of hospitalizations, speaking to the second row, the first chart, historically, we've seen a upward trend, and within the last 5, 7, 10 days, a flattening or decrease. This is again from the TGH data. So the last 2 days I always kind of throw out because the data time frame come in. So those last 2 days on the far right, I generally don't count in the math. But when we see historically, we see a topping and then a slight downward trend in July. And the same thing with the admissions. The last couple of days, I try not to worry so much about, but again, we see an increase in mid-July and now a flattening and now somewhat of a decrease in the end of July. With regard to the hospitalizations by age, that was discussed by Ms. Snively. We wanted to recycle this one to show that was presented just as a snapshot as of yesterday. The hospitalizations, they have all cases, new cases, hospitalizations, and deaths by age. And this was yesterday's data. Historically, looking at the hospitalizations, again, it's everyone above 55 plus make up a vast majority, over 50, 60% of those hospitalizations. The middle age, the 45 to 54, also make up a significant portion, around 13%. And as we've discussed before, the vast majority of the deaths are above the 65 plus age range. I'll stop there. Thank you.
Okay. Thank you, Mr. Wagner. I don't see any questions at this time. Making sure I hear again. No, sir, I don't have any questions. So to you and Dr. Holt, thank you very much. Thank you. Ms. Beck?
Good afternoon, Chair Miller and EPG board members. Christine Beck, County Attorney. We have provided a draft order extending the face covering order in your backup materials. And Mr. Chair, it would be appropriate to entertain any motions related to that order at this time.
Is there a motion?
So moved.
Motion by Commissioner Overman. Is there a second? Is there a second? I pass the gavel to Commissioner Merman. I'll second the motion. Commissioner Merman, you can carry the motion.
Thank you. So we have a motion and the second. Is there any discussion? Are there any hands up? Any questions or discussion?
No hands.
Okay. Ask the clerk to call for the vote.
Miller,
Yes.
Overman,
Yes.
Merman,
Yes.
Castor,
Yes.
Cronister,
No.
Ross,
Yes.
Lott,
No.
Snively.
No.
Motion carried 5-3. Sheriff Cronister, Mayor Lott, and Ms. Snively voted no.
Okay. Anything further, Ms. Beck?
Yes, sir. I do have one more little follow-up from the last Thursday's EPG meeting. Commissioner Overman referenced the Florida Surgeon General's advisory dated July 20th of 2020. And specifically, she asked us if we could compare that guidance document with our face covering order. And so the following summarizes the differences between the two documents. Number one, the Surgeon General's statement is advisory only and not a mandate. Our order is a mandate. Second, the Surgeon General encourages face coverings in both indoor and outdoor settings. The EPG is an order and only applies to indoor settings. Third, the exceptions are somewhat different. The Surgeon General, for example, only accepts children under 2, while our EPG order accepts children under 8. And lastly, the Surgeon General document provides advice about gatherings and vulnerable populations again, as an advisory. So that concludes the county attorney update, Mr. Chair. Thank you.
Thank you, Ms. Beck. I see Mayor Ross's hand is up. Mayor Ross, you recognize?
Thank you, Mr. Chair. I had a question for Ms. Beck, or maybe for you. I don't know if you were going to discuss this during the session. If so, I'll wait till then. But Ms. Beck, if the BOCC votes Wednesday to abolish this group, when do you anticipate that would take effect? Is this to be our last meeting if it passes, or would that be Thursday, or do you know?
Yes, Mayor Ross, the way the ordinance is drafted, it would take effect upon filing with the Secretary of State. So following the public hearing on Wednesday, if the board approves the ordinance, that ordinance is now filed pretty instantaneously with electronic transmission, and so would probably be in effect shortly after the board meeting, more than likely, but we receive confirmation from the clerk, and then the ordinance is effective. So if that were the case, then yes, this would be the last meeting of the EPG.
Thank you, Ms. Beck.
You're welcome.
Okay. Are there any further questions, Ms. Beck?
Oh, not Beck. Oh, not a Beck. Not a Beck. Under discussion.
Okay, I see no hands from Ms. Beck. Thank you, Ms. Beck. We're now moving to EPG board discussions. Commissioner Merman, you recognize.
Thank you. I'm not sure who this is directed to. It'd probably be to Mr. Dudley. I was reading that they're going to put in new testing equipment at Raymond James and the community resource centers. Is that correct? And could you just give us a brief update on that and what that entails?
Yes. So Raymond James, Lee Davis, Plant City, and South Shore, the state will be providing new testing kits. They're self-administered nasal swabs, and they come along with a new lab, E-True North. So we'll still have the staff on the ground. They still monitor and supervise the individuals coming up to receive that testing. This will allow us to have another lab here in our county. Hopefully we can see some trends where that help relieve some of that pressure on our current lab. So we're going to monitor those trends to see the benefits of having access to 2 labs now.
Okay, so how long will it take to get the results back? 2 days?
When we receive the briefing from the lab, they're giving us a standard 3 to 5 days that they're saying for that. But we want to take a look at it. Once we get enough in the system, we'll be able to see what type of trends we're seeing on.
And it is a self-administered test?
Yes.
Okay, much like the one you can get from LabCorp, right?
Correct.
Okay, okay. And then, Mr. Chair, if I can, I just had one other question. And it is about testing. I sit on the board of CareerSource, and it's not just this business, it's many other businesses actually, but they have a team that's traveling to Florida to help them on site with, the business that they're doing, trying to get people employed. And they have to get tested, and then they have to wait 7 to 10 days for results. So, and then they have to continuously quarantine back and forth from Michigan. I guess Michigan and Pennsylvania is where they come from. Is there anything we can do to help them expedite any kind of testing? I guess it'd be Mr. Dudley or Doug Holt, somebody.
If you could send me that information so we can take a look at it.
Okay, I will do that. Thank you. And I've been, actually, it went to Ron Barton. I'm bringing it up today, so I'll send it to him and then I'll send it to you and copy him on it. Thank you.
Okay. Mayor Lott, you recognize. Mayor Lott, you gotta unmute yourself. There you go.
There we go. Thank you. First of all, I just have a few comments I'd like to make. I know there's still a public hearing on Wednesday, and there's another vote, but this, in all indications, and primarily it'll probably be the last time this EPG meets in its current configuration. Just to those members that are sending emails and texts and calling, there's a lot of confusion out there where they think that the vote Wednesday is eliminating the EPG. And I'd just like to clarify, it's not eliminating the EPG, it's eliminating the members of the EPG, or it's changing the composition of the members of the EPG. EPG will still be moving forward. But first of all, I want to thank you, Mr. Chairman, for chairing this group over the last several months. From the first meeting till now, we had no idea what was going to occur the first day we met. And I remember in the 7 days from the first meeting to the second meeting, it was a completely different world. So I first want to thank you for holding us all together. It's been challenging to our community, and anytime you have a change like has occurred in our community, you're going to have pressures on a lot of different angles on who's right, who's wrong, and the reasons why we're making the decisions we're making. So first of all, I want to thank you, sir.
Thank you, man.
Second of all, I want to thank the rest of the members here. I think this is what democracy is all about, is that we're not always going to agree. We're not always going to see a solution the exact way, but we vote on it. And after we vote on it, we continue to respect one another. And I think that the civility we've been able to show in this board here throughout this process has been, I give the group high marks on it. I think the rest of the nation could take good lessons from the way we've been able to go about doing business with the hard decisions and the facts that we have. I would like to ask the county commission that if indeed you do pass and change the members of the EPG, I do hope that you do consider a little more information in making these decisions. I'm not trying to tell you how to do your job, but there's some data I wish we could have had during our meetings that I think that would have helped us, as well as maybe it would have helped our citizen group out there, realizing that we're not pushing an agenda, but we are looking at all bits of information. So we are considering all facts in our community. So as a quick suggestion, Mr. Chair, because I know you also chair the county commission, I really would hope that y'all look at the business bankruptcies that are occurring, unemployment, look at the economic data, look at the mental health, the suicide rates. There's a lot of other key factors. The data that we have is very, very good as far as COVID related, but there's a lot of other issues that are in our community that are COVID related, even though it's not a direct impact or a direct result of COVID itself. So as y'all make this final decision on Wednesday, I know you'll do so with the best interest of our county. But I want to thank all of you for working with you on this time that we've had so far, in case this is our last meeting. And I would hope that the county commission does broaden the amount of information that you look at when you're making the decisions that are affecting 1.5 million people's lives. Thank you very much.
Thank you, Mayor Lott. And let me say this, and let me thank you for your work. If the Board of County Commissioners does decide and take that vote on Wednesday, and it does happen, I want to thank you and all the others that have been that are on this EPG that started this journey back in March and had no idea where we would be at this point, and had no inclination we'd be at this and where we are. But let me say this, that if it does happen, and any information or any decisions or anything we as a county commission will get, I'm going to sit here and say I almost guarantee you that the 3 cities in Hillsborough County, the school board and the sheriff will get that information from the Hillsborough County. We will definitely keep you all abreast of what's going on. I think that's the right thing for us to do. It's our responsibility. If the county commission does take all the emergency issues back over, that we keep the cities, the school board, and the sheriff involved in understanding what we're doing and keep you abreast with all information that's coming forth. Mayor Ross, you recognize.
Thank you, Chair Miller. I want to echo some of what Mayor Lott said. I have, all of us have worked very hard since March. I don't think any of us knew what we were getting in for when we started this. And I have a great deal of respect for my 7 counterparts on this. And Chair Miller, I do want to thank you. I know that you've, as Mayor Lott said, you've had to hold this group together, which has not always been easy. And I applaud your efforts on that, as well as the county staff. I do have to say that, you know, I've been involved in Hillsborough County. Well, I've lived here almost my whole life, and my whole professional life has been spent here. And one of the things that we are known for, that we do as well or better than anybody, is we work together. And everywhere you go, people say, well, we work together too. But when they come here and they shadow us, they all say the same thing. They say, I thought we worked well together at home, but until I saw you guys, and then I see what it really looks like to work together. And I have to tell you that I'm a little concerned about that. And I'm a little disappointed. I'm not mad or angry or anything like that, but I'm a little disappointed that I feel like we're being replaced in the fourth quarter here. You know, we've been at this since March, this group, and we've made some very difficult decisions. All of us have. We've all made some of the decisions that we've made have come at a very high cost to all of us. We've all taken the brunt of the vicious public comments, and so I'm a little disappointed that we would be replaced in the fourth quarter. At least that's how I feel. But the bigger thing that concerns me, and I hope I'm wrong about this, is that, you know, that working together that we're known for, and we sell that. I mean, we pitch that when we pitch for Super Bowls or the RNC or those types of events that bring millions of dollars into our local economy. One of our significant strengths that we pitch is that we work so well together, and we really do. And we can point to these things, the Gasparilla parades and the Super Bowls that we've all done. We all know each other. We work together because we know each other. We have a history together. But that doesn't happen automatically. That starts at the top. And my concern is that this is the top. And one of the things that makes us so good at that is that we face we face hurricanes together, we face pandemics together, we face whatever problems are coming our way. This group, although the people change, but the composition of the group, we face these things together. And I think that starting at the top is a big part of the reason why TPD and the Sheriff's Office and Temple Terrace and Plain City, we can all pull together and work on things. And we know the people across the street. It's not just what color uniform, we know the people. And I just hope that, and this isn't meant as a dig to anybody, I don't mean that, but I just hope that this doesn't serve to erode that. And as people cycle out, as all of us leave office and other people come in, I hope that those relationships continue to develop. But I'm concerned that this starts at the top and that we set the theme for that. And so I just want to say thank you to everybody. And I want to say to the BOCC, I'm not angry. I don't, you know, I'll believe me, I've got other things to do twice a week. But I hope that this doesn't erode our level of cooperation, because I do think we're known for that. And then people say, well, we're the only county that has an EPG. Yeah, and maybe that's why we're so good at working together, because we are the only county that's got an EPG. And if you go to other cities, they aren't capable of working together like we are. This is different. We take it for granted, but it doesn't happen that way all over. Thank you, Mr. Chair. Thank you to my colleagues. I will continue to serve with you in other capacities, and I wish everybody the best.
Thank you, Mayor Ross. We appreciate it very much. Appreciate it. Thank you. Ms. Snyder, you recognize.
Thank you, Mr. Chair. And I will be brief in my comments, but have similar sentiments from the mayors, Lott and Ross. It has been quite an endeavor, a very educational experience for, I think, for all of us. I thank you, Mr. Chair Miller, for leading this group of people. I thank the members for their time and dedication, and the staff. I know the general public may see us for a couple hours twice a week, but but there's a lot of time and effort that go along. We don't just obviously show up to the EPG meeting. There's a lot of data to review, a lot of information, and our constituents to listen to, and there's a lot involved in it. And so, although, as Mayor Ross stated, I have a couple other things. We all have other things that we will be spending our time doing on Monday and Thursday if the vote goes through with the county commission. But I do appreciate being on this, and I'm appreciative of the seat at the table for the 1 year that the school board was able to have a seat at the table. And so I know that we don't always agree on everything, and as we shouldn't, because we represent a lot of diverse parts of our county. But the one thing is true is that we respect each other's opinions, we respect each other's decisions and how we get there. And so, so thank you for allowing me to have a seat at the table on the EPG. And I hope that I'm sure you will engage the superintendent and his staff and anybody from the school district that can help the commission with their decision-making process. So I just wanted to say thank you and wish this group the best, and wish the best to the county commission in taking on these emergency matters for our community. Thanks.
Thank you, Ms. Snively. We appreciate it very much. Thank you. Ms. Wise, you're recognized.
Thank you, Mr. Chairman. On behalf of all the staff, whatever the commission decides to do on Wednesday, I do want to thank all of you. As you've mentioned, nobody knew what they were getting themselves into when this first started, and yet it's still going to be going on for quite some time. So I want to thank you all for your questions. You challenged us. You helped us provide better information. We are now at a point where we have a great dashboard that's on our website at all times for you all to see. And I want to assure you that we will continue to be a partner, work with you, and not make decisions in a vacuum, and that we will continue to work together with you. We are always available for you, and I wanted to just reiterate that commitment.
Thank you, Ms. Wise. Appreciate it very much. Thank you. Is there anything else to come forward before us today? Is there anything else to come before us today? Seeing none, possibly for the last time, we'll adjourn.
Thank you.